Senator Menendez.
Thank you, Mr. Chairman. CMS has recently implemented changes to rein in misleading Medicare Advantage marketing practices, yet marketers are finding ways around these requirements. As a matter of fact, the number of complaints that have been filed nearly doubled. A recent Commonwealth Fund survey found that 10% of respondents reported that marketing callers would ask for their Medicare or Social Security number, which is not permitted under Medicare law. Further, while cold calling is specifically prohibited, 3 out of 4 respondents reported receiving unsolicited calls. Ms. Hoagland, what should CMS be considering to step up enforcement and hold bad actors accountable?
Yeah, I think that's a great question, and you're absolutely right that despite some new guidance, and we talked earlier, there has been improvement in some spaces, but we're certainly seeing in many spaces the aggressive tactics really continue. So, I mean, having CMS be in a position to respond quickly as these are reported, I think is really a critical piece, which we believe they are. I just will share, we continue to hear from our broker partners on an ongoing basis that this is an issue. Their clients are getting called. We know sometimes sweepstakes or contests are used as a way to get them in the door. And so folks not even maybe understanding that they've actually have given their information out. And so that's another tactic that we hear that's being used that perhaps could be addressed.
All right. Because this is a potentially vulnerable class.
Yes.
Now, Ms. Reg, is it Reg or Reg? Reg, okay. As you know, state health information and assistance programs, known as SHIPs, are trusted sources of information for many seniors and people living with disabilities. These federally funded resources are tasked with educating and assisting Medicare-eligible individuals through outreach, counseling, training, and specifically support low-income individuals, those with disabilities, and individuals who are dually eligible for Medicare and Medicaid. Given your experience as a program director, how could providing more resources to SHIPs support efforts to protect low-income individuals and those with disabilities?
That would certainly support the added counseling that we've been doing for that particular population. In Ohio, many of our lower income individuals are going through the redetermination, some signing up for Medicare for the first time or enrolling in the low income subsidy, and need extended counseling and assistance to get sometimes into temporary drug programs to curb the high costs. So our counseling for that population is taking longer. In addition, our population has grown, the scope of options and benefits has grown, and we're trying to keep up with that. We're fortunate to have our base grant funds and Priority 1 for MIPA funds, but it's not keeping up with growth. Additional funding could support that.
And I'm troubled by reports that vulnerable individuals, particularly low-income and dually eligible individuals, are being targeted by deceptive marketing tactics and are often enrolled in plans that just simply don't meet their needs. What else can be done specifically to better support these populations and ensure that the care that they need is the one that they get?
For SHIP programs, many of us utilize direct entry into Medicare's complaint tracking module, or CTM. And as I shared earlier, a lot of times we're reactive. They're already in a plan that's not a good choice for them, and we're trying to get them either back or into a plan that is a good choice. If the plans were required to include the agent on record in those complaints, it would help us with the investigatory aspect of it. We're a SHIP, again, that sits within the Department of Insurance. The only regulatory authority that the states have really is on agent activity, and it would help us identify some of the bad actors.
Finally, Mr. Blumenfeld, we know that seniors often find the process of selecting their coverage to be confusing, difficult, overwhelming. I was looking at it now that there's open enrollment, and I'm not sure that even as someone who is pretty well versed in some of this would know how to make the best decisions. Many Medicare beneficiaries rely on a broker to assist them with choosing their coverage. Almost 1 in 3 people ages 65 and over said they use a broker or agent to help them choose Medicare coverage, yet they still often don't end up in plans that are best for them. What do you think consumers should know about making their plan decisions?
First, brokers are not required to put consumers' interests first.
And I think that needs to change. We operate differently at Chapter. We do put consumers' interests first, but that is by far the exception and not the norm. So I think it's important for consumers to know what the incentives of their advisors and their trusted guides are. And then I think there's a whole host of data challenges that need to be solved to make sure that the information is available to consumers so that they can make informed choices, because today it's very challenging.